Hi, I'm Dr. Srinivasa. I am the Chief Surgeon and CEO of the Institute for Advanced Breast Reconstruction, and I'm here to answer all of your questions about the BRCA mutation and preventative surgery for prophylactic mastectomies. The BRCA gene, along with many other genes, basically means that the patient has an increased risk of developing breast cancer and sometimes other cancers in their lifetime. Generally speaking, your lifetime risk of getting breast cancer can be as high as 75 to 80%. And if we can do things to help screen better, or even surgery to prevent breast cancer from happening in the first place, we want to be able to counsel and advise a patient on that. But what's really important to know is if you're going to have surgery, there's nothing that any one person can do to 100% prevent breast cancer. But there's a lot a patient can do for risk reduction. Patients who come to me with the BRCA mutation or just high risk for breast cancer, but they don't have a cancer diagnosis yet, it's actually the best situation because it allows me to do as much as I can for aesthetic reasons, because I'm not working within the confines of a timeline for cancer treatment or chemotherapy or radiation. So one really common example, women who maybe have breastfed, their breasts have dropped with gravity or they've lost volume. Well, I can do a breast reduction or a breast lift as part of a cancer reconstructive operation, so insurance covers it. And we can lift the nipple, optimize the breast pocket, and get everything set so that when you do have your mastectomies, we can then save the nipple, we can limit the scar to the underside of the breast, and do your reconstruction in a breast that is set up for a better aesthetic result. If you are a patient that suspects you have a BRCA mutation or another high-risk mutation, or you've been diagnosed with a high-risk breast cancer mutation, make sure that you see the right doctors. There's so much nuance to this. What's important is that you as a patient know that you have options. And so if you see a doctor and they basically tell you, this is how it is, this is how we do it, that's not how it's supposed to go. You're supposed to get options, and you are supposed to have the freedom to choose and the information that you need to make a really good decision.